name's Cassandra Cannon. I go by Cassie. I'm a licensed clinical psychologist as well as an EMDR approved consultant, and I'm also approved by the APA as a sponsor to provide continuing education. And one thing I wanted to talk about today is, when do you know when your client is ready to move from that preparation phase into reprocessing your identified targeted memories? So one of the first things you want to ensure is that your client has stability and safety. And that ranges from stable housing, a stable home environment, to do they have any current suicidal ideation or significant self-harm risk? If those items are not stable, then they're not ready yet. If they've had a recent psychiatric hospitalization, I would say like 30 days. I would not move forward. Wait a period of time, make sure that this crisis period is over. Do they have supportive relationships? So in between sessions, when their emotional bandwidth is a lot lower than usual, do the people around them understand that? And do they know how to support? And you also want to confirm that they're medically stable. And that also includes if they have a history of seizure, that you're not using eye movements. And if they have an ongoing seizure disorder, you want to confirm that they're stable with their physician. If your client has a substance use disorder, or you're also addressing problematic behaviors like gambling, overeating, pornography, gaming, things like that, that they have a supportive recovery network. And that means that if they're having a lot of cravings after session, they've got someone or multiple people to reach out to help them through those periods of increased triggers and cravings. And that also means that they have a relapse prevention plan in place. And what that specifically looks at is, what are your triggers? What's the corresponding coping skill? And that's a longer conversation, which I'll have another video on that. So coping and emotional regulation, can they exhibit basic emotional regulation skills? Can they name and tolerate emotions without dissociating? And can they ground in or outside of session, or even just with your support? If they can ground with your support, that's fine. And can they maintain dual awareness? So that means they can be aware of the memory we're processing, but also know that they're here. And if they can maintain that dual awareness while you are also maybe talking over the sets, then that works. That's enough. You also, similar to when we were talking about earlier about the supportive recovery network in between sessions, similar to that, you want to make sure that they have a plan for managing their distress outside of their sessions. Trauma and dissociation screening is really important, and I'm not familiar with how things are now, but when I did my original basic training, they really said, here's the DES or the DES2 and use it. But they didn't really go through how you score and what that means and what these different answers mean, and then what do I do with that information. And so I actually created my own tool for that. It's the dissociation pattern tracker, and I'll do a different video on that because I felt like that was a huge gap. So that's first. Second, can they return to grounding or present day with your help or without it? And do you have a plan how to address that dissociation? Regarding motivation and consent, some clients aren't necessarily motivated for EMDR. I had someone recently who initially it seemed like they were motivated, and then when we started introducing it, they wanted to talk more about just present day things and have more supportive verbal processing. So we switched there because the motivation had changed. If your client has insight into that connection between my symptoms are, a big factor of my symptoms are these events in the past, they need to understand that as to the why we're going back into the past. For people who are not interested in looking at the past, then you're going to be looking more at cognitive behavioral therapy, DBT, ACT, so dialectical behavioral therapy, or acceptance and commitment therapy. Those are going to be those are also evidence-based, but they're more about present-day symptoms than why I like EMDR is rather than having to use these coping skills necessarily to address the present day symptoms, you're addressing the root or the reason why they respond. And then finally, that clinical preparation, is the history taking complete? And with that, and I do this a little bit differently, when I'm doing my first evaluation with the client, I don't ask them to give me all of their trauma in detail. If they want to initially, then I'm just writing it as they're talking. But a lot of people prefer to just kind of give you just kind of the overview. And because I don't need to know the details in order to necessarily write a full treatment plan. And I don't need to know the details when we're reprocessing either. But I personally like to know the clusters so that then I can move into target selection and sequencing. So what I'll do is I'll kind of get an overview in the initial first phase. And then once I've done preparation and I feel like they're ready, then I'll return back to those generalized clusters because now I am confident that we can do float backs, affect scans. I'm more confident that they can do that without dissociating or getting overwhelmed. And then I can get the specific targets and then I can sequence them. So that way I know they're ready for it and we're not going to run into any struggles when we're getting that history. And then one thing that's really important is, are you, as the clinician, prepared in the sense that, are you able to be with this material and this information and still stay that grounded presence with your client? If you realize that there are certain types of trauma that you just don't do well with, then I recommend that you either do your own treatment so that you're able to maintain that solid connection with your client, or maybe that's just a type of client that you just refer to someone else. Because what's really important is that your client really does need, I also use internal family systems. So if you use that lens, they need access to your own self energy. Or another way to put it is they need to be able to access you and your presence. And they really need that sometimes to feel really safe. There's this tool that I went through. It's called the EMDR Client Readiness Checklist. That's a free tool. And that is also going to be a link in the comments. So I hope this was helpful. Again, my name is Cassandra Cannon. I go by Cassie.